Hello, everyone, and welcome to today's Lunch and Learn Reflection and Recognition. My name is Srithi Chirker. I'm a Quality Programs Manager with the Implement Heart Failure Program based out of the Chicago region. We really hope that you've enjoyed our Heart Failure Awareness Week activities this week, and we're really grateful to you all for joining us and everything that you do every day for your heart failure patients, heart failure care, and the community. Before we get started with our final lunch and learn for the week, I'd like to go over just a few items so you know how to participate in today's event. This lunch and learn is being recorded and will be sent out via email within 24 hours. Today's presentation can also be downloaded in the handout section. We have the videos that we'll play and a recognition criteria document available for you there that you'll see here today, but you will also have access to later if you download them. All dial-in participants will be muted to allow the speakers to present without interruption. And you'll also have the opportunity to submit text questions by typing those into the questions panel of the control pane. You may send in your questions at any time during the presentation, and we'll collect those and address them at the end during our Q&A session. If you're experiencing any technical issues during the presentation, most can be resolved by refreshing your browser. If your issues are not resolved, please log off and log back in, and that will usually do the trick. So I'd like to share with you all a very special address that we have from Dr. Clyde Yancey as he reflects on the journey to improving heart failure care and recognizing the tremendous achievements made possible by your dedication and commitment to heart success for your patients and your communities. Dr. Clyde Yancey is the Chief of Cardiology and the Vice Dean of Diversity and Inclusion at Northwestern University Feinberg School of Medicine and the Associate Director of the Bloom Cardiovascular Institute at Northwestern Memorial Hospital. He's internationally recognized leader in heart failure care and cardiology and has served in several organizational leadership roles. He's extensively published with well over 500 peer-reviewed publications. He's very passionate about heart failure care and healthcare disparities, amongst other areas of interest, and he has graciously shared those passions, expertise, and leadership with the American Heart Association, serving in a variety of leadership capacities, and most recently recognized as a recipient of the AHA's 2021 Chairman's Award. He's helped the AHA transform heart failure care and continue to push for the best health for patients and community, and we're really grateful to have his address here today.
Hi, this is Clyde Yancey, Professor of Medicine and Chief of Cardiology at Northwestern University Feinberg School of Medicine, former President of the American Heart Association, and former member of the Executive Committee for the Heart Failure Society of America. I am delighted to give you this greeting coincident with 2022 Heart Failure Awareness Week. Over 20 years ago, leaders of the HFSA had the presence of mind, the vision to say we should bring a sharper focus to this condition that we're increasingly recognizing, known as heart failure. We had to provide definitions in the very beginning. We had to help people understand the difference between heart failure and heart attack. We didn't have significant numbers of therapies to offer, but we had a passion, we had a conviction, we had a restless curiosity about a condition that we could already see was becoming a burden for the community, and we needed to address that burden as intelligently and as quickly and as decisively as we could. We had significant early failures, let's be clear, but we've had substantial successes as well. Now, some 20 years later, where are we? We're looking at a condition that still requires our time and attention, no question about that. But rather than emphasizing heart failure, we're not thinking about heart success. We're not thinking about heart remission. We're not thinking about stronger hearts. We're no longer emphasizing the heft and the burden of a failing hypothesis. We're no longer looking our patients in the eye and saying, one of your major organ systems has failed and this is a bad thing. No, what we're saying is that, you know what? Your heart muscle isn't working as well as it could. We have therapies that can help. Never before in the history of cardiovascular medicine, here in 2022, have we had the portfolio of effective therapies that we now have to treat this condition. We're no longer tinkering with the symptoms. We're actually dealing with the actual pathophysiology. We're actually providing an improvement in quality of life, an improvement in longevity, a relief from hospitalization. It's not perfect. It's not absolute. Not everyone benefits the same. But even for advanced heart failure, we have more therapies, we have more opportunities, better outcomes with the advanced therapies. From the beginning, from prevention to treatment of advanced disease, we've seen breakthrough after breakthrough after breakthrough. That's why watching this progression of Heart Failure Awareness Week over the last 20 years or so has been so rewarding because we've actually seen progress. So many of these kinds of awareness moments are simply that, a moment. This is not a moment, this is a journey. And the journey's going in a very, very good direction. I applaud my peers in the HFSA who had the presence of mind to start this awareness week. I applaud the current leadership of the HFSA for being the champions, for beating the drum, for being out front and saying this condition requires our attention. I applaud my peers within the American Heart Association for saying we are partners deeply invested in this quest to reduce the burden of heart failure, to alleviate the necessity for hospitalization. And one of the things that's become top of mind for us is to narrow the gap in heart failure outcomes between different groups of patients. We want to provide the best care always to every patient without any other consideration of any other demarcation. We're on that path and we will get there. Let me be very clear. We're excited. We are celebrating Heart Failure Awareness Week with you. You will view this video at a moment when Get With the Guidelines Heart Failure Achievement Awards will be recognized. Celebrate, stand up, clap. You're making a big difference. It's wonderful for your team to be acknowledged, but it's even better for your patients to be benefited. Heart Failure Awareness Week is something that I hope one day goes away because we will eventually crack this code. We will eventually understand exactly what we need to do to prevent this. And if it does start to halt this progression, those answers are off on the horizon, but I don't think it's a long horizon. We're getting there. We've come a long way in 20 years. Imagine how much further we can go in the next 5, 10, 15, or 20 again. So enjoy, celebrate Heart Failure Awareness Week. I wish you all the best. Keep up the good work. You're doing the good stuff. You're doing the work that matters. You're making a difference in the lives of patients, and you're restoring hope in the ears of people that have heard about failure. Thanks very much.
Thanks so much, Dr. Yancey, for that wonderful address and taking us through that journey of heart failure care and reminding us that we should be celebrating our achievements and our successes as we move towards heart success, as he said. So with that, we will now move over to discuss the recognition that Dr. Yancey just mentioned about the Get With the Guidelines heart failure recognition happening this time of year. And Robin Kaiser, my colleague, will help walk through some of the information for that. So Robin, I'll turn it over to you.
Thanks, Ruthie. It's really hard to follow Dr. Yancey and that inspirational address that he gave. That was so inspiring, but we'll get down to a little bit of the nitty gritty. We wanted to walk you through how to run reports for recognition in the IRP, show you a little bit how to drill down to those outliers so that you can go in and review some of your data and make sure that everything is documented accurately and get ready for those recognition awards that Dr. Yancey talked about. And then I'll show you a few IRP library resources that you can use. So if you go to the next slide, Ruthie. You guys have probably seen this before, but we also have these as resources for you to use in the handout section of the GoToWebinar. You can download those now. And I'll go through these reports, but you'll start with the achievement measures. And you want to make sure that you have at least an 85% compliance in each of these measures to qualify for an award. On the right side, you'll see the award levels. Bronze would be for meeting all 4 measures for 1 quarter and can only be achieved once. This is usually for hospitals just starting out, so they can qualify for an award sooner. Silver is for 1 year's time frame, and gold is for 2 and has to be 2 consecutive years. So if you qualified for a silver award last year, for instance, and you can maintain it this year, that would move you to the gold award. Excuse me. And if you look at the bottom left, you'll see the quality measures, and you need to meet at least 4 out of these at 75% compliance to add that plus portion to your award. And you have to earn that achievement award first. You can select which of these measures to focus on for your plus award. On the bottom right is the target heart failure award criteria. And you'll need to meet all of these at 50% compliance to qualify for the target heart failure honor roll. And for both the plus and the target heart failure honor roll, you would use the same data used in your achievement award. If you want to go to the next slide, Shruti. This is the newest honor roll to add to your award. And again, you have to earn the achievement award at a silver level or higher to add this. And you have to be at least a 90% compliance rate on the overall diabetes cardiovascular initiative composite score and have at least 10 patients with either a new onset or previous history of diabetes. And you can see the measures listed here. And I'll show you how to run each of these report bundles in the IRP shortly. And Shruti, if you want to go ahead and start that. Today I'm going to show you how to run reports to get ready for recognition. And I'm using our demo site, so there is no real patient data that you're going to see. So first of all, when you log into your IRP page and you get to your community page, the first thing you want to do is click on your reports page. And then your heart failure measure reports. Now you want to set up your parameters for your reports, and you're going to do this annually based on your 2021 data. As we said, this current recognition period is looking at data from January to December of 2021. So you want to select that to look at all your data. For the demo site, I'm going to go back to 2020 just because I don't have enough patient records in to show you otherwise, but you would set your parameters for 2021. And the first thing you want to do is run your heart failure achievement bundle set. If you just select this box, if you open this up, you're going to see that all these measures were selected because I checked this box. You can, of course, run these individually, but we've put these in a bundle for your convenience. And you have to meet an achievement measure before you can add any of the other, the plus or the target heart failure honor rolls or any of those to your award. You have to qualify for the initial achievement award. So you want to look at this first and then apply parameters. Now there's a couple of ways I like to set up my report that I think makes it easier to view. If you look over here to your display options and drop this box, you have the option to graph similar measures. So what that does is puts all of your measures on one nice graph so you can see them all at once. And then if you add your achievement goal, that'll put the 85% compliance line at the top of your graph so you can see immediately where you qualify and where you don't. And so what you would want to do is look at the measures that don't qualify, and of course this would be my post-discharge appointment. And I'm going to show you how to drill down to those outliers and really check your data and make sure you have everything accurate. But before I do that, I want to show you a couple other things on this page that you can do with this report. Up here at the top, if you click Print Similar Measures, this will bring this report up in a nice little PDF for you so that you can either save it on your desktop or print it off or share it with your quality meetings. And it has your bar graph and the measure details right on this PDF. So that is just a convenient way that you can share this in your team meetings. So before we go on to drill to outliers, I'm going to go back to my parameter page and show you a couple of things. So say all of my measures were at least 85% on my achievement measures, and so I could qualify for an award, and I want to see if I can qualify for the plus portion. I'm going to run my quality measures in the same way. And you can do the same thing here. You can display these all on one bar graph. And then you can add the plus goal, and that will add that 75% line across the top. So you could get a really quick visual to see if you could add the plus portion to your award. You've seen in US News, you've seen them listed as a silver or gold plus, and this is how they get that plus. And as I said previously, you have to have at least 4 of these quality measures that qualify at least 75% or greater to get that plus portion. So this is a way, a snapshot that you can get that all in one report. And then if I go back to my report page, I just want to show you where you would get the other reports that you would run. Suppose you can achieve an achievement award, and so you'd want to see if you can add the Target Heart Failure Honor Roll Award to it. And so this is where you would run that report. And it would be the same thing. It would show you all the measures, and you need to at least meet each of those at 50% better or better to qualify for that Target Heart Failure Honor Roll. The newest Target Type 2 Diabetes Honor Roll is a little bit different. So I'm going to show you that. That would be up here under our diabetes measures. So if you just open up this list, you want to scroll down to the overall diabetes cardiovascular initiative composite score. What that is a composite of all 8 of the measures that show where you're at in the diabetes composite score. And you have to be at least 90% or better in compliance to add that to the honor roll to your award. So that's where you run all the awards and get those. So I just wanted to show you how you get the initial awards. Now we're going to go back to our Heart Failure Achievement Award measures so that I can show you how to drill down to those outliers. And then again, I'll just show you to graph similar measures. You just open up your display options, and then you can add your achievement goal here. And then this is back where we started. So I know I need to work on this post-discharge appointment measure. So you can either click on it, and then that pulls everything just on this measure if you want to just focus on this one. Or you can highlight all of them and then look at your measure details on all 4 of these measures. What this will show you is your total patient population. I have 194 patients in this year, and your time frame. Yours should say 2021, but I had to use 2020 for the demo site. And then it'll give you your numerators and denominators, and then your percent of compliance over on the side. And so I need to really focus on this measure because I see I'm only at a 57%. So you can just click anywhere in here to highlight it. And then go down to the bottom and pull up your case list. And this is going to pull up all of those patients and show you who is included, who is excluded, who's in your numerator, who's in your denominator, etc. And all you need to do then is to go up to your little filter bar and add your filters. Because what we're trying to do here is to drill down to the outliers on this measure since I'm only at 57%. So you want to look at all the patients that are in your denominator, because however you documented in the IRP, that patient was either pulled into the denominator or not. And so you'll uncheck the empty box just to get to that list of patients in your denominator. And I only had 7. Your hospital should have much more, of course, because the majority of your patients should qualify for this measure. But I'm sure in the demo site, it's because we just don't have all the data entered on these demo patients. But you'll pull up your list and all the patients that should be in the denominator. And then you want to see the patients that are not in the numerator, because those will be your outliers. So I'm going to uncheck this. So this takes me right to this list of all my outliers. And so it's really quick to do on any of your measures so that you can see which patients fell out of that measure. And I only have a few patients here, but you can see if your hospital has a whole lot of patients, which you probably do, this is a really quick way to drill down to those outliers right away. There's several things you can do once you get here. First of all, you can access each of these patient records directly from these links. And so I would go in here and just look at this patient's record to make sure I have everything documented accurately, and maybe I have some dates switched around or whatever. You just want to make sure that it's correct. And you can look at the whole record, but I'm going to go straight to the discharge portion to look at this post-discharge appointment. I can see I do have scheduled a follow-up visit, and this is an office visit. So I needed a date and time, and I realize I only have a date. And so that's why this patient is an outlier. So I would want to go back to this patient's record and see if I can find that time. And once I put that in there and then save this record, this patient will no longer be an outlier. It will pull them back into the numerator as a compliant patient. And this is true if it's an office visit or telehealth, you'd need the date and time. If this was home health, I would only need the date. But that's one thing you can do just to make sure that you have things documented in there correctly. And you can do that with any of these patients that come up on your list. But I want to show you a couple of other things. As I mentioned, I have 194 patients in here. So the majority of my patients should have met this measure, because everybody pretty much should get a post-discharge appointment. So if you feel like you have a lot of case records that are falling out and they're being excluded from the measure altogether, I'll show you how you can look at that. So first of all, I'm going to just bring up the rest of my patient records and show you a couple things you can do here. First of all, this just gives you everything. Those that are included, excluded, those are in the numerator, those are in the denominator, etc. You can just look at this to see right away what you have going on. And then if you right-click anywhere in this list, you can export this to a table. So then you would be able to just add your data filters. So you could use this to really filter down to these patients so you can get a better visual of what's going on with all of these patients that you have entered. So first of all, using your data filters, you can, if I wanted to drill just to those patients that were excluded, for instance, I could just do that. Or if I wanted to just look at the ones that are included, I could do that. And then one of the things you want to just look at over here is the dates. Do you have dates of first visits? Do you have locations and that sort of thing? And I noticed that I do have a lot of those listed here, but I'm not getting credit for these patients because they fell out of my denominator altogether. So I want to see why all these patients are being excluded. So I want to show you some resources that you can use to do this. And so if you go into the left side of your dashboard here over to these 3 little bars, and you can click on those, that opens up your little side panel, and go to the library. Here you have a list of all the achievement measures descriptions. And you can do this on all of the measures, but we're going to look at the achievement measures because this is the one that we are wanting to understand. And I want to look at the post-discharge appointment measure. And so right away, it gives you the definition of the measure. So basically, this is all heart failure patients who have a scheduled follow-up appointment documented and having both location and date and time for office visits and telehealth. And then the home health visit requires just the date. Then it will give you your initial patient population. So based on these data fields on your patient form, what you have documented here determines whether this patient will be pooled in the initial patient population or not. So one of the first things you want to look at on all those patients that were excluded is, do you have these fields completed? So you have to have a diagnosis of heart failure with or without CAD. You have to have your admit date and your date of birth so that it can calculate whether this patient is greater than 18 years of age. If you have all these documented and you make sure you don't transpose any dates or everything's correct, that should pull your patients into the mix. Now, to pull them into the denominator, sometimes you have a little bit different criteria on a measure. For this particular one, it's the same as the initial patient population because it's basically saying that all your patients should qualify for a post-discharge appointment follow-up. So make sure that you have everything, all the data entered in these fields, and the patients are not being excluded because of that. Then you will have some legitimate exclusions, and that will list them here and tell you which field that pulls from. So such as patients discharged to hospice or expired or left AMA or had a medical reason for no follow-up appointment, et cetera, or patients with a negative calculated time difference. So you do want to make sure that you have your dates in there accurately. And you can scroll through this list and see all the reasons why your patients were excluded. So if you use that Excel spreadsheet I showed you, and then you just walk through your inclusion exclusion criteria, you should be able to tell right away why patients are being excluded. And then some measures have exceptions. This particular one doesn't, but those would be listed here. And then finally, to be in the numerator, they have to have these fields completed accurately, the date and time and place for that follow-up visit. Another thing I wanted to show you on this form, if you scroll down, you'll have the rationale for this measure. This talks about why this measure is important, why we want to look at it, and the rationale for that. It will even give you the link to the published guidelines that you can use to really dig into the evidence behind this. It'll give you the class and evidence of that measure as well. So these are very useful things that you can use when you're trying to collect data and document on your patients. And you can use these for every one of the measures. We have them for the quality measures, reporting measures, and all of those. Some other things I want to show you here in the library, there's also the coding instructions. And so you can access from your electronic form that you're entering the patient data also, but you can also access the coding instructions here. That gives you a lot more information on each of the data elements that we are asking in the IRP, and it gives you some more background, some notes for abstraction, and some things that will help you there. I do want to let you know that we are getting ready to upload the most current updated 30-day follow-up coding instructions. These are not the most up-to-date ones. We are getting ready to put that in here. You also have a case report form. So this is basically a PDF copy of the data that we just looked at. So I just showed you the heart failure limited form where I was entering patients. And you would be able to print that off if you want and have all that available as you're abstracting if you want to, so that you can abstract it into your data on that form and then put it into the electronic form. But all of those are here for you to use. There are some instruction guides for you. There's one on a CSV uploader guide if you want to use that to learn how you can try to upload data from, for instance, your electronic health record. There are other program materials here, such as the Give the Guidelines Heart Failure Fact Sheet, the information on target heart failure. Oops. There are some webinars here that you can use and view that are helpful. There's information on the recognition that I just showed you on the diabetes and also just the general heart failure. There are some user guides and trainings that are very helpful. There's just a general training on IRP use. There are training on using a step-by-step guide to enter and use custom fields. That is a very, I think, beneficial tool that we have. There are instruction videos. There's videos on how you can run reports like I just showed you. There's one on generating your outliers, which I showed you. So there's lots of resources here in the library that you might want to look at. Also, when we do updates in the IRP, whether it's guideline changes or just things that we have corrected or enhanced, those release notes will always be here. And you can always go in to see what was changed, what's new, anything on any new releases, that will all be listed here. Also, in today's newsletter, you should have seen there's lots of links in there on some other resources, including a link to the AHA recognition website that will answer a lot more of your questions. So I hope this is very helpful, and we're going to go ahead and open this up for any questions you might have now. So hopefully
Thanks so much, Robin.
Thanks, Ruthie. And hopefully that was helpful. And so we just wanted to basically give you a few reminders. You can go ahead and type any questions you have in the question panel now. And we have a team standing by to look at those. The deadline for recognition is to make sure you have all of your data entered and finalized by March 31st. We recommend you try to get that in at least by mid-March, because then that's going to give you some time to walk through those recognition reports that I showed you and see if you have any outliers or any data corrections you need to make. If you do make your corrections and you've been notified by your quality programs manager or somebody that looks like you are on track for award, you want to make sure that you're not entering any additional data until we run those final reports. And of course, you'll receive your 2022 recognition certificates sometimes later on in the summer. You know, it does take time for us to get through all of that and to have you all listed in US News and all those various different, marketing strategies. And that is, remember, based on your 2021 data. So you just want to look at that and make sure that everything's accurate there. And of course, reach out to your quality programs manager if you have any questions. And we'll also have some PR and marketing materials that you can use to help you with this too. So Sruthi, I'm going to turn it back over to you guys to see if there's any questions.
Thanks, Robin. There's two people with their hand raised, so I'm just wondering if they maybe want to type their questions into the questions panel so we can get to those. So I think it's Kenna and Anna, if you wouldn't mind typing your questions into the question panel, and then we'll be happy to answer those. While we're waiting for those to come in, a question did come up asking if this was going to be available to review at a later date.
Are you talking about the recording? Are they
asking
the recording?
Yep, if they can reference the recording.
Yeah, I think they can access it. Sruthi, tell me if I'm wrong, but I think they can access it from the handout section today, can't they?
I believe so.
But we will also put these in our folder where we're putting all of our other collaboration calls on heart failure awareness week videos. So you'll be able to access it from there if you can't access it from the handout section. So we'll make sure that you guys get that.
And you'll also receive, for anyone who's registered, you'll receive a copy of the recording in the next 24 hours. So you can also access this demo from that recording.
Thanks, Ruthie and Robin. Would you be able to go back to the slide with the award criteria? There was a question about target diabetes recognition criteria and the composite score, what the requirement is. I don't know if we're able to reference back to that slide. It is also available in the handout section of today's event, but the overall needed composite score for target diabetes on oral recognition is 75% or greater for the calendar year.
Yes, you're right. And I think I did say that wrong on the video. So I apologize for that. It is 75%.
Another question that came in was, we're new to the Get With the Guidelines Heart Failure Registry. Is there a mentoring program or a veteran abstractor that could help with some coding instructions, questions in real time when I'm abstracting a case? And I can help answer that. So I think probably the best way for this would be to reach out to your local quality improvement manager. And if you don't know who that is, we can definitely help you connect with them. We can take down your email address from today's event and connect you with your local quality improvement manager. We are more than happy to help answer some of those coding instruction questions. It's what we do, and going through some specific case scenarios, and we can also help you connect with another abstractor in your area. So we will definitely have your quality improvement manager reach out to you. I see a couple of hands still raised in the chat. So I think, Anna, not sure if you have a question, if you wouldn't mind typing it in to the questions panel, we'd be happy to address it for you. Or if anyone else has any questions, feel free to type them in and we'd be happy to get to them. There was a comment that there was no audio. Are you all able to hear me?
Yes.
Yeah, we can hear you.
Lynn. For anyone, if you're experiencing issues, we will, like I said, if you registered for this, you will get the recording link and can at least review at that point with the audio. Sorry to hear that there may have been some issues with the audio for others.
Thanks, Ruthie. And it looks like others can hear us. So you said, I think we can just send out the recording. I think we'll do one last call for any questions before we close out today. I'm not seeing any other questions. Team, are you?
I'm not seeing any others either, Lynn.
Thanks, Ruthie. Well, with that, I think that we can close out today. Just a reminder, you will receive a recording of today's presentation that you can reference back later. You can also download the handouts in the right-hand panel of your control panel for today's event. We really appreciate Dr. Yancey's address. We appreciate all of you for all of your hard work and dedication to improving heart failure care. Thank you to Robin and Sruthi for leading today's event. Thank you to all of you that have engaged with us throughout Heart Failure Awareness Week. And again, we continue to look forward to working with you as you strive to achieve Get With the Guidelines Heart Failure Award recognition. Feel free to reach out to us and your local AHA staff at any time. So thank you for everything, and we appreciate you. Have a great weekend.
Thank you. Great presentation, ladies.